Dr. Ghandi, so nice to see you again. We spoke on Friday and you were telling us some of the indicators that the surge might be ending soon. Can you tell us about those?
Yes, couple of things. One is that there was a paper just published today that's essentially showed us that once you get Omicron in your region, it takes about 30 to 40 days. It's very standard to peak and then come down. So we're at that point now. Second is our wastewater. I know people have never before in their life thought they'd be looking at wastewater to this degree. So wastewater will tell us the amount of COVID in the environment because we excrete it in our stool. And our wastewater has already peaked and come down with COVID. So that means that our cases should peak next couple days and then come down, take about 3 weeks, 4 weeks to come down at the most.
Because right now we're still seeing a higher positivity rate. It hasn't spiked up. We've been around 22, 23, but hospitalization rates are still going up. Why is that?
So a couple of things. The wastewater goes first, and then the cases start coming down after that. Actually, hospitalizations are not going up. For example, the UCSF pediatric hospitalizations have plateaued. And I'm working in the hospital last week. Our hospitalizations are starting to plateau, but really it will take a couple more days for our cases to peak up, hospitalizations to peak up. Then after that, it will come down. So again, the wastewater goes first.
Okay.
And our wastewater just peaked.
So the people in the hospital.
Give it this week.
Okay, that's good. That's very promising. The people in the hospital now, we know most of them are unvaccinated. Are they in the hospital with Delta, Omicron, both?
Well, this is an excellent question. So the CDC director 3 days ago said likely our residual deaths in this country are from Delta, unfortunately. So Delta also had to come down. Omicron took over. Omicron is less virulent of a variant. It just is. This Kaiser, California study showed that out of 52,000 people in the hospital, no one needed a ventilator, and there were shorter stays. However, what's going on in the hospital right now is that those who are unvaccinated are the most sick, and then there are a lot of people testing positive because we test everyone in the hospital. And LA County estimated about 67% of people who are hospitalized are there that incidentally test positive. That's true across highly vaccinated regions. And then the rest are there actually for COVID.
Okay. So during this pandemic, we've seen these surges every time there's a new variant. Is this going to be the new normal when a new variant develops?
The difference now is that a lot of people are getting Omicron. So what would make you be able to fight the next variant? Seeing the entire virus, because then you've developed immunity across the entire virus. There are a lot of people who've been exposed to Omicron. Dr. Fauci said last week, probably everyone will be exposed to Omicron. Even if you've managed, there are some people, of course, who haven't been exposed to Omicron, but all the people who have essentially developed immunity across the whole virus. So say a variant comes in 6 months. That variant may have mutations across it, but you've just developed immunity across the entire virus by seeing Omicron. Again, I'm not saying go and get Omicron. I'm saying a lot of people did get Omicron.
That it could start snuffing it out, these cases of COVID. Okay.
Correct, because you have immunity across the whole thing. Yeah.
Right. Dr. Monica Ghandi, we love having you on our program from UCSF. Thanks so much for your time this Monday.